Physiological changes during pregnancy. During pregnancy, a woman's body goes through many changes to support the growing baby. These changes affect almost every system in the body and are necessary for a healthy pregnancy and delivery. If we don't understand these normal changes, we might confuse them with disease conditions. Genital organs. Vulva becomes swollen, edematous, and has more blood flow. In some women, varicose veins may appear, especially if they have had multiple pregnancies. Labia minora become darker and larger. Vagina. Vaginal walls become thicker, swollen, and more blood-filled, giving a bluish color, Jacqueminier's sign. The length of the front vaginal wall increases. Secretion. Vaginal discharge increases and becomes thin, white, and curdy due to shedding cells and bacteria. The pH becomes acidic, 3.5-6, due to more lactic acid, which prevents infections. Cytology. Cellular changes. More navicular cells are found in vaginal smears. Lactobacillus bacteria are present in high amounts, helping maintain vaginal health. Uterus. The uterus grows significantly to accommodate the baby. It increases in size, weight, and capacity. Before pregnancy, weighs 60 grams, 7.5 centimeters long, and holds 5 to 10 ml. At term, weighs 900-1000 grams, 35 centimeters long, and can hold 500-1000 times more than before. Body of the uterus. 1. Growth and enlargement. Uterine muscle fibers grow, hypertrophy, and increase in number, hyperplasia, under the influence of estrogen and progesterone. By 12 weeks, this growth is most noticeable. After 20 weeks, the uterus stretches as the baby grows, and its walls become thinner, about 1.5 centimeters at term. 2. Muscle layers. Outer longitudinal. Covers the fundus, upper part. Inner circular. Around the openings of the fallopian tubes and cervix. Middle crisscross layer. The strongest layer, arranged like a figure, 8 feet, helps control bleeding after delivery by squeezing blood vessels. 3. Blood supply. The uterus receives more blood during pregnancy, especially from the uterine and ovarian arteries. Blood flow increases 8 times by 20 weeks due to hormones like estrogen and progesterone. Veins enlarge and lose their valves. 4. Shape and position. Early pregnancy. The uterus is pear-shaped piriform. 12 weeks. It becomes round, globular. 28 weeks onwards. Returns to an oval shape. Normally, the uterus tilts forward, anteverted. In early pregnancy, it may press on the bladder, causing frequent urination. Later, it straightens and shifts slightly to the right, dextrorotation, because the bowel pushes it from the left side. 5. Braxton Hicks contractions. From early pregnancy, the uterus has mild, irregular, painless contractions called Braxton Hicks contractions. These contractions do not cause labor but help prepare the uterus for delivery. Near term, they become stronger and more noticeable. Isthmus, lower part of the uterus. The isthmus softens and elongates about 3 times its original length in early pregnancy. It helps hold the pregnancy in place, acting like a sphincter valve. If weak, it can cause mid-trimester abortion, and a cerclage operation, stitching the cervix, may be needed to strengthen it. Cervix. 1. Structural changes. Becomes soft, Goodell's sign, from 6 weeks onward. Becomes bluish in color due to increased blood supply. Glands in the cervix grow and produce more mucus. 2. Secretions. Increased thick mucus production, leukorrhea, which contains antibodies and cytokines for protection. Forms a mucus plug that seals the cervix to prevent infections. 3. Position and shape. The cervix remains firm and closed until labor begins. In first-time mothers, it stays closed and only thins out, effaces near delivery. In mothers who have given birth before, the cervix may be slightly open. Fallopian tubes. The tubes are pushed upwards as the uterus grows. They become congested, longer, and their muscles grow. Some areas show decidual changes, meaning the tissue reacts to pregnancy hormones. Ovaries. 1. Corpus luteum. Produces progesterone in early pregnancy. Grows to 2.5 centimeters by 8 weeks, turns orange-yellow, and later shrinks by 12 weeks as the placenta takes over hormone production. Eventually becomes calcified by the end of pregnancy. Key takeaways for nursing students. Pregnancy brings normal but significant changes to a woman's body. These changes help support the baby and prepare the mother for labor. If we don't recognize these as normal, they might be mistaken for diseases. Understanding these adaptations helps in better patient care and management during pregnancy.